What happens if our loved one or a loved one leaves treatment, AMA, against medical advice? The best way to describe this is to explain a story. We had done an intervention on a young man, brought him to treatment. The therapist at the treatment center, and this is why we're very selective on treatment centers we use, they pick the facility, not us, and the reason why we didn't pick it is because we know this is the type of thing that happens there, but nevertheless, the family picked it. And the family called us in a panic and said, hey, the facility's calling saying, we need to buy our loved one a plane ticket home. He's not compliant. He doesn't want to be here. He's threatening to leave, and you need to come get him. So we called the center, and let's just say, as professionally as we can maintain our conversation, the therapist probably isn't a fan of us to this day, and we had to include the owner of the facility. And anyway, they asked us what our recommendation was, and we knew that we had full leverage on the situation, meaning this young man couldn't do anything without the help of his family. So we said, tell him to leave. And the family was on board with it. The center was not. And I said to him, I said, guys, he'll be back in an hour. Well, I was dead wrong because he came back in 30 minutes. Guys, when people leave treatment against medical advice, it's the same exact reason why they say no at an intervention. There's 3 reasons why they do it. A, they're not done drinking or drugging. B, they don't think you're going to follow through with boundaries. And the third one is the 2 things I just said. When somebody tries to leave treatment against medical advice, they just want to go get high, guys. It's not when you leave treatment, it is how you leave treatment. And a family almost always has leverage and or boundaries that can prevent that and would do what's called an AMA block. Not always. There are times where the person still has a credit card, they could fly home, and the family can still resort to holding the boundaries and the consequences that we discussed at the intervention. If they're leaving treatment against medical advice, it's like pulling the IVs out of your arm at the hospital and leaving. Who would sign off on that? And the sad thing is some family members do. They think, oh, he's been in treatment 2 weeks and we were able to FaceTime him and the kids were happy. Oh, he can. Guys, you can't allow them to come back after they've left treatment against medical advice. You have to let them finish their treatment. If they're walking out prematurely, they're still sick. And just finishing up and going back to that story, that client also became one of their best clients and stayed in that facility for 9 months because that was the jarring experience that he needed to understand that his family was serious. Sometimes the wife or the husband has to do that to their spouse so they know they're serious. Sometimes the employer has to say, you walk out of there, you don't have a job. Sometimes we have to tell the nurse or the doctor that if you leave, I'm calling the medical board. Or if an attorney tries to leave or a pilot, I have to call their board. Or I have to tell them if you leave, I'm calling the Department of Children and Family Services. I mean, who do the people think they are that they can just walk out of treatment and come back home and wreak havoc on your life? It's the utmost act of selfishness and self-seeking, arrogant, egotistical behavior, if not narcissistic, with an antisocial personality disorder component that I've ever seen. So when they try to leave treatment against medical advice, first and foremost, if you've done the intervention with us, we're going to help you through that in our aftercare. And secondly, you have to start preparing for a life where they're not in it. And I know people are like, wow, this guy's harsh. It's like, then go back to the way it was. Because those are your 2 choices. Follow through with detachment or go back to the way it was. And guys, there's no gray. If there was, I'd share it with you. We have to hold addicts and alcoholics accountable. And because being a voluntary hostage in their life helped the situation, said nobody ever.